And if you're like me, though, you may get confused by all the numbers that we have to track. So I wanted to tackle in this segment the 5 health numbers that are most important for us to be staying on top of. I sat down this morning with Dr. Lori Rothman in Palm Beach Gardens today. She's been practicing medicine here in our community for more than 20 years. She said cardiovascular disease and cancer, the leading causes of death for women. So here are the 5 numbers we should all be tracking to stay healthy.
We need to know what our blood pressure is and if it's normal or not. 40% of American women have hypertension. So it's a startling number, and knowing that cardiovascular disease is the leading cause of death in women, that to me is number 1, know your blood pressure. 2, blood sugar. Are you normal blood sugar, pre-diabetic, diabetic?
Dr. Lori Rothman makes sure her patients know a 3rd number, but she breaks it down 3 ways.
So many people have high cholesterol. They don't really know what that means necessarily. We have the LDL, the bad cholesterol, the HDL, the good cholesterol, the triglycerides. Those numbers, you should know them.
Dr. Rothman tells all of her patients teasing out those 3 numbers is critical. LDL among the most important.
That's the type of cholesterol that will put plaque on your arteries and put you at higher risk for a heart attack or for a stroke. So we want that number for your average risk person to be less than 130. Ideal is less than 100. HDL is the good cholesterol, so not all cholesterol is bad. HDL is the cholesterol that helps protect us. So an HDL above 50 in women is what we're looking for. Bring me down here. Okay.
And then triglycerides, which she says is another fat in the blood that comes from carbohydrates.
We want those less than 150 and ideally really less than 130.
Dr. Rothman says exercise, eating healthy, plant-based fats is really key, like nuts and olive oil. They can raise your good cholesterol, she says, and protect our hearts. So here they are. We're going to post them for you right here. Jot them down, if you will. The 5 takeaways from our health report tonight. Know your numbers. Number 1, blood pressure. You want it to be about 120/80. Sugar level less than 100. LDL less than 130. HDL 50 to 60. Triglycerides less than 150. If it's less than 130, even better, she says. Of course, Dr. Rothman's going to tell you always consult your physician for your specific target goals on those numbers. Your numbers may be different than your neighbor's numbers, may be different than my numbers, all, due to pre-existing conditions, other factors as well. But good numbers we should all be tracking during Women's Health Month and beyond.